So, welcome back to She Really Gets It. I'm Stephanie Rhodes, health educator and reformed public health professional. On this podcast, we spend a lot of time talking to public health professionals about why they got in the field and the real truth of what it means to work in the field when you have multiple identities that are marginalized and that will subject you to discrimination. In the past episodes, we've talked about what it means to be Black and a woman in the field of public health. Today, we're going to focus on what it means to be Black and LGBTQ in the film of public in the field of public health, and primarily what it means to be Black and MSM, or what it means to be a Black man who has sex with men in public health. So, I know for myself, as a public health professional, as a cisgendered Black woman, cisgendered heterosexual Black woman, you can find so many articles about health disparities and what's going to kill you and Black maternal death while not actually seeing anyone that looks like you in a leadership position working in the field or being in a leadership position within hospitals or health systems where all this harm is happening. And the same can be said for Black men who have sex with men and gay Black men. And we've talked a lot on the show already about homophobia and how the role of racism, the role of homophobia in shaping public perceptions of infectious disease and in shaping public health policy, and how these biases end up being deadly, especially with groups that have those multiple identities that are undervalued. So what I mean by that is being both Black and a woman, or being both disabled and a lesbian, or being both Black and gay. So as a public health professional and a Black woman, I've read all of this research, I've done all of that, and I know that the same can be said for gay Black men and Black MSM. So for today's conversation, I wanted to talk to one of my favorite public health professionals and former colleague, Mr. Rashaad Banks. He has worked in the field of public health for over 10 years, facilitating and training other public health professionals, community members, corrections officers, and more on the topics of sexual health, of sexual diversity, and cultural humility. He is also my forever sushi date and my favorite pug lover. So let's start here. So I'm Stephanie. I'm a straight Black woman. Rashad is a gay Black man. We are not representative of all members of either group. All opinions expressed here are our own and not that of any organization, just us. And we're just going to talk about our experiences in this field. And primarily, Rashad's going to talk about his experiences in this field. Because if you have listened to this podcast ever, you have heard me talk enough about myself. So, as a previous guest stated, public health is a white dominated field, specifically in public health leadership. And more to be truly honest, and statistics would back me up in this. Public health is a white woman dominated field, right? And there are stats to back that up. Um, the Beaumont Foundation did a survey looking at just the governmental public health workforce, and it showed that it is largely white, female, over the age of 40. When you see people of color, and there are plenty of people of color, but they're primarily working at the staff level. They're working within areas of outreach. They're doing the education and prevention, but they're not necessarily in leadership roles. They're not necessarily those that are leading specific studies in public health, which dictates, what is considered important. So, Rashad, I'm going to turn it over to you. I have a few questions for you. So, the first question I have is, why did you choose a career in public health?
Good question. Um, I think for me, when I went into college, I really had no clue what I wanted to do. It wasn't until around my senior year that I started volunteering with the Red Cross and doing a lot of like facilitation and like assisting with like their CPR classes, natural disaster classes. And I saw two things. I saw like the difference that it made of just being able to like give people education and give people tools and stuff to better themselves but also I was seeing that people who looked like me, people who identified like me, were being left out of conversations or were being kind of tossed aside. There were a lot of things when I was volunteering or interns or just like seeing organizations, it was a lot of kind of what you mentioned. I was seeing like white women or older like white men trying to educate communities about what disparities are or why certain people who look like me, why we're at risk of certain things. And I was like, this isn't right. It's wrong. And it's really a lot of times demeaning the way they were talking to people. So I said, let me then kind of go in and be able to do this kind of education and give people tools, but also do it in a way where people can relate and understand and actually see, someone who can understand what they're going through or the challenges that they face.
Yeah, and I can completely relate with that feeling of they're treating you like you're a problem that they need to solve.
Yep.
And or they're like, or almost like you're some type of disease that they studied.
Oh yeah. Oh, definitely. Definitely.
I know I've been in those classes where like they're talking, I've like where it's primarily like all white people. They're talking about black people as though we're a hypothetical group of people that doesn't exist in real life. You're just like,
hmm
I'm here.
Yeah. Yeah. Or they use you as like, you like you should see on TV where like you're that one token in the class, and it's like, give us your perspective on why Black people are at risk for these things, or why gay Black men do these things, and everyone turns to you, and I'm like, yeah, I can't speak for an entire community, so I'm like, yeah, no, thank you.
Well, Rashaad, remember we were work husband and work wife. We used to teach together, and
We
we had
did.
we had students that asked us that. I remember a student literally asked us, "What's wrong with black people?" I was like, "Sir, wait a
Oh,
minute. I know you're not."
we had so many problematic people in the classes we used to teach that made me think, how did you even make it to this point in your life? Like, whoo.
These weren't children; they were adults.
No, these were like
These were
30,
adults.
40-year-olds and like having like, clients and serving communities. And I'm like, how did you make it out the womb? But we did our thing. We did our
We
thing.
did our thing. And so so moving on, if and when you've experienced discrimination while working in the field of public health, how has it been addressed by those in leadership? If you brought it up to them, to people in leadership, if you didn't, why not? If you did, what was their response?
I mean, yeah, I definitely have faced discrimination in this field on numerous levels by numerous people, from fellow folks who work at the same level of me as to folks who were in higher positions. And I have always been someone who wants to, if I see something is going wrong or I am, being treated poorly or other people are, I try to speak up. I'm not going to say I always do, because sometimes, as we know, when you speak up in certain organizations, you get penalized. So sometimes you got to walk that fine line. But the times that I did, it was a lot of the show. Oh, we understand. Oh, no, we don't do these things. Thank you for bringing it to our attention. We will do better. But majority, not all, but majority of the time, nothing ever changed.
Yeah,
It was always just talk the talk, but no one ever walked the walk.
yeah, yeah,
So a lot of times then it would be up to me or other folks at my level to try to bring about change. And then when we did, the higher ups would take credit for it.
oh god,
hmm
that's the worst.
Yeah.
That's the
hmm
worst. That's the
hmm
worst. I think I learned like earlier, well, as early as I possibly could. I kind of learned like, oh, human resources, this is a sham.
Yes. Yes, indeed. Yes, indeed. Yes.
Human resources is the ultimate sham. I was like, oh, so they're not here for the humans that work here.
No, not at all. They will say and they'll post certain things about, we value diversity or we're looking for this and we're looking for that, but they're really not.
Yes,
And it's ridiculous in a lot
yeah.
of places.
when I think about a message that I always want to get to young people, especially like that are want to work in like the nonprofit world and work in public health, I'm like, don't trust human resources, especially if you
Mm,
are a minority. I was like, I was like, they're not there for you. If
mm,
this were a perfect world, there would be unions in all of these nonprofits
mm,
that would advocate for you because the unions are actually there. That's who's there for the workers, the laborers. If there are any young people listening to this podcast and you are working in a space and you're being discriminated against and you're saying, let me go to HR. Yes, go to HR with specific facts and dates and all of that, right? But do it knowing that they are there to protect that company.
mhm,
Even that nonprofit whose mission is social justice,
mhm,
equity, or it's a woman run nonprofit or public health org, know that their mission is to protect that organization at all costs. That's
mhm.
their job.
Yeah.
That's who pays their bills. They are not, this is not the unions are the ones who are there for workers. So when you find places and hospitals and nonprofits that are anti union, I'm not going to say run. I'm just because, you got to work somewhere and, unions are finally on the rise again. But in general, HR is not your friend.
And if you do get a job at those places, document, 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 and
X.
keep everything that HR ever gives you, every workbook, every manual, you
Yep.
read that. Anything they have you sign, you keep a copy. Anything, conversations that you have with them, you make sure you follow up, confirming or reiterating in an
Yep.
email. Keep that because that will be your saving grace when they try to screw you over.
Yes.
It's a lot of, we didn't say that. We didn't promise it. Oh, no, no, no. Let me pull up this conversation at this date, at this time. Here's my receipts.
Yep. And even if you're just writing it down, having dates, times, and what was said,
Mm-hmm.
woo,
Oh,
is
yeah.
is a powerful thing. They will be scared of you.
Oh, yeah. Oh, yeah.
I didn't think that worked. I was like, that doesn't work. And then, yeah, I had my own situation. Oh my God, that definitely works. Yes, always keep those things,
Mm-hmm. Mm-hmm. Mm-hmm.
especially when you're a Black person, you're a Black woman. Whoo, you're a gay Black man. Oh my God, if you're trans, anything,
Mm-hmm.
keep records of everything. And it's sad that it has to be that way, but I also want people to be armed with facts and with just the truth of what you're going to deal with.
Yeah.
And it doesn't matter if it's for profit, nonprofit, public health, finance,
Mm-hmm.
you're going to deal with that. Um, so yeah. So, we're talking about like what it means to be Black, what it means to be Black and gay, to have that intersecting identity, because at She Really Gets It podcast, we are always intersectional. And I was thinking about, my experience working in public health, working as a Black woman. And, there are a lot of women in public health in general, and there are men. And in the field where I worked, there were a lot of gay Black men, but I didn't necessarily see them in leadership positions in public health. Why don't I see more gay Black men in leadership positions in public health? Why do you think that is? Not that you know the ultimate answer, but why, from your perspective, what have you seen that you think is impeding that?
I think it's two things. I think the first thing is a lot of these public health organizations, as much as they say they're about change, they're about, going with the times, they are very much stuck in a, this is how things were done mentality. So these organizations, even though they cater and serve certain communities, they were founded, majority of them, by white men.
Yeah.
The people on the board are usually white men. So it's a lot of, well, this is how things have always been done. We're going to stick with tradition or make the board happy. And the board wants to see people who look like them. They
Yeah.
feel more comfortable. I think the other reason is that gay Black men scare straight cisgender white women and straight cisgender white Black. I think they scare straight cisgender white women and scare white men, regardless of how they identify, because I feel like they feel like you as a gay black man, without even knowing your personality or knowing you, but they're like, you as this identity, oh, you are going to be feisty. Oh, you're going to tell it like it is. You're that stereotype that we see on those shows, and we don't know if we can handle that or if you're going to be able to, quote, fall in line. So we want you, but we don't want you in a leadership role, but we still want you a part of the team so we can say we have you.
Yes.
Mm-hmm.
Almost like putting you on the brochure.
Yes. Oh, yes, exactly. When I was in college, I went to a very small college in Pennsylvania,
Yeah.
and I was an RA, a resident assistant, and they wanted to take photos of like people on campus. And you got to believe I was one of the very few black RAs. They called me lickety split and was like,
What?
"We need you." And again, like the same thing. It's not about necessarily what you can do. I think some of it is, but a lot of it is we want to be able to show you off and be like, "Look who we have on our
Yeah.
website's photo. Look who we have when we're applying for grants. You see that black face? You see that gay face?
Yeah.
We got them. Give us your money."
Yeah.
Mm-hmm.
Yeah. And it's really like off-putting when I think about who's most affected in certain areas by certain like diseases, certain have certain health outcomes. Even if you look at, because I gave a statistic about government like public health positions and government public health executive level positions, it's primarily dominated by like white people. And you look at just HIV, right, and Black MSM, and you look at the statistics around that and like their likelihood of contracting HIV in their lifetime, which is not like a be all end all. That is not like a thing that is definitely going to happen to anyone. But if you look at the stats on that, right, on STIs and Black men who have sex with men, you would think that if you look at those positions and who should be directing policy, that I would see a lot more Black men who have sex with men directing policy, not just one, not just the sole one token that they allow to be in a leadership position or to have a voice. Because every once in a while you say like, this one person, I'm like, y'all have the same man that I see at every conference.
Mm-hmm.
He's the sole one, there can be only one. Um, and as opposed to like, no, I should see this in the federal government. I should see them at HRSA. I should see them at CDCS. It should see them working in this, in this government organization and this one as well. Why don't I see that? And I think it is that mentality of, well, we can't have them directing, directing too much. We know best. That white savior complex
Mm.
comes into play. Like, no, but we need to be the ones in charge. We know best how to do this. And you see that as no matter like how high up you go. And I have my own theories on that. That's a whole other thing about how we keep recreating that, because we know that, the mission of public health is to, create conditions in which all people can be healthy or can achieve optimal health. And when I think about public health nonprofits and public health organizations, even if they're for profit, they don't do that. They don't create optimal conditions for health. Well, in my opinion, public health nonprofits create optimal conditions in which white people and wealthy people can be successful within them. If you look at development opportunities within public health, most of them are unpaid.
Mm.
So who can afford that? Who can afford that? Here goes a development opportunity. And we want most of the people who work here to have engaged in these particular development opportunities. And it's usually things like, Peace Corps, AmeriCorps, where they basically want you to live in poverty so that you can really get at. As part of how I got like the title for this podcast, you really get that. That's part of it. This whole like, idea of you need to struggle to really understand public health and understand health disparities. And for me, I thought about that for a while. Why do they want that? I was like, well, you know what? The young white women that they want to hire need some type of curated hardship experience.
Mm-hmm.
I don't need to. I don't need a curated hardship experience. You don't need a curated hardship experience. I've had it, right?
Mm-hmm.
Right. My family was enslaved in this country. My
Yeah.
great grandfather was a slave, and great great grandfather was enslaved in this country until he was around 7 years of age. Um, so like, I don't need a curated hardship experience. I'm good. I need this is what I need. Like I need to learn SAS. I need to learn these particular hard skills. Can you help me with that? Like I've got this down, right?
Mm-hmm.
I know what I want to do. I know where I've been. I know where I want to go. Can you help me get this? But they don't have that. Or you have to pay for that. Or, some exorbitant fee for that. And that's what it's for. So public health is about creating those optimal conditions for optimal health. But if you look at the conditions in which you can be successful, right? In order to have optimal health, you have to have a good job. You have to have decent finances. You have to be able to access care. But if you look at how so many of these nonprofits work, they don't provide that. And if you don't come in already wealthy, you don't come in financially stable or financially privileged, oh well, they're just going to recreate the conditions in which you are always going to be struggling financially, in which you will have a harder time getting jobs and keeping jobs. So I don't know if, you have noticed that or what your experiences are with that. But I know that that was my experience of that.
Mm-hmm.
Um, how can we create, if you were to give advice about creating optimal conditions in which Black LGBTQ people can be successful, what advice would you give, these people in leadership about how to actually create those optimal conditions in which Black LGBTQ people can be successful? What would that look like?
Oh gosh. I think that would be like telling these folks in leadership that not every Black LGBTQ person comes in with the same story. And that seems like a duh. Of course, not everyone has the same life and lives the same thing. But I feel like a lot of these folks look at these young Black LGBT individuals and say, like, oh, because this is who you are, I know exactly the type of stuff that you want. We're going to put you into the outreach and we're going to have you talk to all the other young people, all the other people who may or may not look like you, and you teach them and educate them. And it's always just that no matter what your upbringing is, what your experience is, they look at everyone. I feel like they look at everyone as the same. They have the same skills, the same personality, and they want to pigeonhole them in the same position. So what I would say to them is, it seems like a no-brainer, but it's like look at the individual on an individualistic level and see what their skills are, to see what their strong points are, their educations are, and see how you can actually really help them grow and help them shape your organization, and not just expect them to go in just certain catchments or certain places in your organization to just fill certain quotas or to just fill certain things because that's what they feel like you're only good for.
Yeah. It's like when all the Black people work in DEI.
Yes. Oh my God.
Diversity, equity, and inclusion for those
Oh
that don't know what
God.
DEI
Yes.
is.
Yes. And don't get me wrong, I want to see diversity in those committees because they
Yes.
can have it. But the first instinct shouldn't always be, oh, you're that Black guy, you're that Black gay guy. We need you. I worked at an organization where I had someone wanted me to join the DI committee, and it was this person blew so much smoke up my butt and was just like, I value your opinion, and I think you do so much for the organization, this, and this. And I'm like, you've been working here 2 days. You just got hired 2 days ago and they asked you to like lead this. How do you know what I bring to this organization? I could be the troublemaker, which I'm not. I'm not. But they automatically just saw, oh, you are gay, you are
Yep.
Black. I have to have you on here because you will, having your face, like I said earlier, having your face
Oh, yeah.
as a spokesperson,
Oh, yeah.
people will see, look what we're doing it. We're
Oh,
doing
yeah.
it.
Oh, yeah.
And then I'm like, and then when you're on it, then they don't even listen to your opinions and your thoughts and your input. It's just, we just
Yeah.
want you as a showpiece for
Oh
everyone.
yeah. Oh yeah.
Like,
Definitely been there. I think with black women, they want us to be like this. I mean, it's hard to find a good way to say this. They want you to be like the mammy.
yeah.
Like everywhere I've worked, where like I've worked somewhere and there were black women that they liked, like that white people liked. It was always, oh, you know what? She's like a mother to us.
Mm.
That's how
Mhm.
black women they liked it. And they were successful in a lot of these spaces. She's like a mother to us. She brings
Mhm.
in cookies and cakes. And, I was like, what the fuck?
Mhm. Oh yeah. Oh yeah.
So they thought I was a stone cold bitch, which I'm not. They thought I was a stone cold bitch. I was like, no, I'm not doing that for you. Or they want
Mhm.
me to be downtrodden
Mm.
and, I
Mhm.
need your help so they can like have that
Mhm.
feeling once again that white savior feeling of like, look, she needs our help. Oh my God.
Oh
I mean,
yeah.
I had a certain supervisor that was always like that. I looked at like the black woman she liked. I was like, you like her because she tells you all her problems and she needs your help.
Mhm.
I know not to do that at this stage in my career. Maybe in my early 20s, I probably was doing that. I don't know. Maybe. I don't know. Probably. Because 20s, you're dumb as hell.
Mm.
But well, not all 20 somethings. Let me not, I don't want to alienate an audience, but people aren't all stupid. But you know, I did all sorts of stupid stuff. I know at work when I was in my 20s, especially my
Same.
early 20s. I
Same.
did
Same.
lots of just stupid crap. Don't know how I didn't get
Mhm.
fired. But
Mhm. Same. I hear ya.
you know, um, but I will say, like, I noticed that. I was like, okay, you don't need my help. You're not, I can't like make you an asexual mammy. You're not motherly. You don't need my
Mhm.
help. Oh, I don't
Oh
like
yeah.
her. I don't know.
Mhm.
I don't know if she's the right cultural fit.
Hmm. Oh yeah,
Nope.
I hear you. I've seen that plenty of times. And for me, as a gay black man, it's always, we want you to be that sassy, always funny, always making us laugh. Like I mean, if they want you to be the Titus
Oh yeah.
Andromedons from Unbreakable Kimmy Schmidt. They want you to be
Oof.
that humor that's always going to come in and tell the older white ladies that their shoes are ugly and that they're fierce and that they're throwing shade so they can feel
Oh
like
yeah.
hip and they can go to their friends and say, oh, we've got this hilarious gay guy in our office. And he's just so
Oh yeah.
sassy, girl.
Oh
Like,
yeah.
that's what they want. And
Oh
when you
yeah.
don't give them that, it's the same thing. It's like, oh, well, we don't know how we feel about
Oh
you.
yeah.
You're intimidating, or
Yep.
you speak your mind too much. But as soon as you give them a linking of like the ha 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 ness, it's okay. Everything's great. You're great. We love you. You can do no wrong
Oh
until
yeah.
again you step out of that box they want you to be in.
Oh yeah. And it's like all of a sudden the tables turn so quickly.
Oh yes, they do.
It's
Yes,
like
they
you're
do.
not playing the role. Like you
Mhm.
need to play this role, and how dare you step out of that? Now
Mhm.
I'm angry.
Mhm. Oh yeah.
Like I
I,
think about how many studies are written about like black people and indigenous people and Latino people and like what's wrong with y'all? And I'm like, we we're not the problem here. Like y'all
yes.
need to write studies on yourselves.
Yes.
Like
Yes.
you need to study yourself and why you have this complex and why you need people of color to fit into a very specific box.
Mhm.
And if they fall out of it, I was like, so many people are wondering, well, like, have these exit interviews with you, like, why don't we
Mm.
keep any people of color? It's like, it's not that complicated because you don't want them.
Yeah.
It's not complicated. You don't
No.
really want them. You might want, once again, you might want them on the brochure. And like you said, you were on the brochures for your college in Pennsylvania. I'm
Mhm.
still on brochures
Mm.
for my junior high school in Mississippi.
Oh my gosh.
I
Oh,
am
wow.
still,
Not
yes.
that I'm saying you're old. Not that I'm saying you're old, but
But
wow.
I mean, yes. Yeah, it's like that. It's like that.
Mm.
It's
Mhm.
like that.
Oh yeah. I see that.
So,
And mhm.
yeah.
And you're right. And like as soon as you step out of it, it's like there's a problem. And I have, I've had a number of jobs in my career in like different parts of public health. And it's always interesting when I do, like you just mentioned, when I do those exit interviews and they ask you those questions about like, well, what could we have done better? What could we have done to make you stay? Or what trends are you seeing? And it's like, you're telling me that through all these people who have left, no one's told you these things, or you're not aware of these things. You just are comfortable making the change, and you want to keep things where they are, and you want to find another to replace me when I leave.
Yeah.
Because
Yeah.
I've gone back to previous jobs to visit like old coworkers, and I'm looking like, did someone clone me?
Right.
Like, why do I see a Rashaad 2.0 in my
Oh
old
yeah.
cubicle?
Oh yeah.
And then they come
Oh
up the first thing they say is, "I'm the new Rashaad.
yeah.
I'm the new you. Everyone says how I'm like you." And I'm like, yeah, I know. Let's talk in 2, 3, 4 years when you leave, and let's see what happens then.
Oh my God. It's the freakiest thing, right? Because
Mm-hmm.
I remember going into a certain medical association
Mm-hmm.
and walking around their office, and they all had everyone broken into different groups. They had like 52 different teams. Okay. And every team had like the same structure.
Mm-hmm.
It would be like, you know, the chief of the team would be like a white woman or a white man. Typically, it'd be like white men in this particular place, right? They usually be like PhD or MD, so doctoral level degree. And then you would have like some white dude who would be doing, I don't know, like project management, maybe that kind of thing. And then you would have a white woman who'd be like the little office manager for the team. And then you would have this black woman who would just basically be like almost doing operations, keeping everyone organized, making sure the schedule was together. And it was every single team had the same little structure. And I remember just looking like, do they not see what they're doing? And like, is it am I crazy? Like, and then you went to diversity, equity, inclusion team, and it was a whole little division, diversity, equity, inclusion. And that is literally where all of everyone there was black or Latino. It was
Mm-hmm.
that's where the majority of the black and brown faces, like 90% of the black and brown faces that work there work in diversity, equity, and inclusion. And they stayed in their little area, right? They would
Mm-hmm.
do their presentations because that's because diversity and equity, it's just the job of that division. They do that thing over there, and we're gonna continue to do what we do over here. We're not
Mm-hmm.
gonna change anything else, but we're gonna say that we have this DI team. Um, so yeah,
Oh yeah.
it's
Mm-hmm.
wild.
Yeah.
Do
Mm-hmm.
you have, Rashad, do you have any advice for any Black LGBTQ people that are interested in the field of public health? Is there anything that you would like to say to them about working in this field, why you should work in this field, um, or why not?
I would definitely say to work in this field. I would definitely encourage folks to work in this field. What I will say is you have to make sure that you have a passion for this
Yeah.
field. If this is something you just want to do because you're unsure of your life, or you feel like this will just be something, new and exciting, yes, go for new adventures. But to be able to go through all of the obstacles and hurdles you're going to face, you have to know that this is the work that you want to do. I would also say is know your self worth. Know what you are worth financially,
Hmm.
monetarily.
Yep.
Know what you are willing to put up with. Know what you are willing to have to, when it, know what you're willing to actually like change your life around for. Essentially, for a lot of these public health jobs, we're underpaid, and
Yep.
especially people of color are even way less underpaid than other people. There are, different hours and days of the week, and sometimes you're asked to do things you don't always feel comfortable with. So I think knowing your boundaries and knowing your self worth, I think is going to make a big difference when you're coming in ready to do this work. Knowing those things, I think is going to help you be able to, like I said, set your boundaries, be able to advocate for yourself, and also be able to advocate for other people who are going to need you who's going to need your help.
Yeah. Yeah.
Mm-hmm.
Well, thank you for that. That's such good advice.
Mm-hmm.
And thank you so much for sitting here and chatting with us, Rashaad. I know you are very busy. Uh,
I
Ye- yes. And to the audience, thank you so much for listening in. And please write in about any questions, comments, or concerns. And if you think you really get it, send in some
am.
answers. So be sure to follow She Really Gets It on YouTube, Spotify, Amazon Music, and wherever else podcasts are found. Ta-ding!